Hi, good afternoon. I'm Dr. Bill Christenberry at Caldwell Mill Animal Clinic. And today we're going to talk about enteropathy. And I guess I've drawn the short straw because enteropathy is basically diarrhea. But even though that may be the short straw, it is very important. And why? Because intestinal upsets and problems with our pets that relate to the gastrointestinal tract are probably the number one reason that we see patients that they're presented to us. So it's important. We got to know about it and want to talk about it. So even though it's a difficult thing to have and to talk about. When pets are first presented for diarrhea, we want to get a history, find out. There's a lot of things we can find out because a lot of times it's from things that pets have eaten, and so if we can nail that down, we can make a pretty specific and quick diagnosis, and that can help us. Sometimes there isn't enough history, and so we'll go ahead and do an exam for certain, either way, to check for problems within the intestinal tract, because we can palpate, we can feel, we can hear with the stethoscope if there's problems within the abdomen that would give us clues. And then we want to get a stool specimen. We were always taught in veterinary school that a stool specimen is a window into the intestinal tract. So we want to open that window up and take a look, because that can help us make a diagnosis and know what we're dealing with there from a diagnostic standpoint. And so usually that's where we need to go. Although there are some much more complicated reasons for diarrhea that we would need to get into if it's a more chronic problem that's been going on for a much longer time, we've treated before and it's either resolved and come right back, or we've not been able to get it under control, then you need to do some other further diagnostics to check for other things like pancreatic insufficiency, protein losing enteropathy, obscure parasites that are hard to uncover, many different things that can cause diarrhea, but most of the problems are pretty easily dealt with in a short-term period. And so the way we would do that after we've done those initial diagnostics is treatment. We would want to, a lot of times we'll give fluids, some subcutaneous fluids, meaning under the skin. They usually don't need an IV, to replenish some of the fluids that they've lost and the electrolytes that they've lost through the diarrhea, and that'll help them feel better and to help them distribute the medication that we're going to put them on as well. We'll give an injectable antispasmodic for the intestinal tract that'll help to artificially slow down the diarrhea while the medication for the primary problem is being absorbed. And so a lot of times we'll put them on an antibiotic as well, because that helps to rebalance the intestinal flora that's been knocked out of balance. We'll put them on a probiotic because that helps to replenish the good bacteria that they've lost through the problem that's caused the diarrhea. And we'll usually use a diet that's specific for diarrhea. It's bland. It'll help to contains bioflavones that will help to decrease the diarrhea and slow that transit down. And so those are some of the things that we'll do to help to treat diarrhea. And most of the time, that'll take care of it, usually within a day or two. And a lot of times what we see, people ask when we've treated for diarrhea, a lot of times they'll go home and then they won't have a bowel movement for a couple of days, and people get concerned about that. And that is something we need to watch out for. But most of the time, the dog's so emptied out from the diarrhea that they've had that when they start eating, and everything's got to catch back up, and so they may go a day or two without actually having a bowel movement. So that can happen as well. So a lot of different causes, reasons why pets get diarrhea. One of the most common problems that we see. So if your pet does have diarrhea, you need to let us know. You can give us a call. We can decide if we need to see them. A lot of times we can deal with some simple things over the phone, but depending on how long it's been going on, how severe it is, if it has blood in it, things like that, we may need to see them immediately. So just let us know. We'll help you talk through it and figure out where to go with that diagnosis and with the treatment for your pet. Hey, thanks for listening, and we will see you next time.